Good morning. It's 9:30. Today is Saturday, January 6th, 2024. Is the first Saturday of 2024. This is our weekly yoga therapy class. And before I start, let me just do a little sound check. Check, check, check. Let me just to be sure everything is okay. Before we start, here we are. Before we start, okay. Hope all of you can hear me. And we'll start with a, there is nothing called New Year's resolution. A friend of mine sent me a very nice picture of a New Year's resolution. First day, I was doing a, daily yoga asanas. The next day, half down. Third day, and by fourth day, it was all just laying down, not able to get up from the bed. So that is not the issue. What issue today is, as a new year, we are going to do a class today for yoga therapy for maintaining health. What does it mean? So if you practice a regular daily yoga, you will develop definitely we call it a roger chikitsha. That means treatment of the underlying chronic lifestyle related disorders. And then what will happen is called shastharokha, or maintenance of health. These maintenance of health prevents us from other, we call it a lifestyle related disorders, which we call it endogenous diseases, which is killing us today. And primary cause of this is obviously stress. Stress is a high sympathetic tone. It creates the biggest phenomena on us, what is a irritable bowel syndrome, and irritable bladder, irritable, you name it, the blood vessel get into spasm, high blood pressure, diabetes, truncal obesity. These are all part of your, we call it a metabolic syndrome. So let's start with the yogic phenomena or the concept of health. Definition of health, sometimes it's very difficult. In our Western medicine, we are very good in taking care of the disease, but health is one which is, we have a lot of work to be done. There is Ayurveda, there is a big, Sanskrit word, samodosa, samoagnika, samodhatu, malakriya, prasannavatta indriyamana shastha iti abhidhayate. So basically, samodosa means balance, basically all about balance of your psychophysical body type called dosa. Samoagni, balance your digestive fire, which is the most important to maintain your health. Samodhatu, that dhatu means your body tissue. All the body tissues are in balance. Samodosa, samoagni, samodhatu. Prasanno atta indriyaman. Prasanno atta. Hey, here comes my granddaughter. She does yoga every single day. Do you want to do yoga? Do you want to show them? Or? Yeah. Yeah? What do you want to do? Can you do a, let me see. Can you do a tree pose? Can you do a tree pose for me? Let me help you doing it. Or you are busy eating? Okay. Come back later then? Okay. Thank you. So this is another thing we've been doing. We've been teaching yoga to the children, and we will to start. My granddaughter started yoga actually the day she was even born. She does yoga every single day with her mother. So coming back, Prasanna Atta means your soul is very content. That means what you call a happiness. And the best part of a health, like people who live longer, 90 years, 100 years, young people, first thing they will say, they're content with what they have, you know. They're content with what they have. And Indriya Mona means the 5 senses connecting to their mind. You want to do some yoga poses? Yes? Yeah. Okay. What do you want to do? Let me see. She wants to show us some yoga poses. Let's do some yoga pose with me. Want to do it? No. No? Okay. See you later. Okay, she has done her part. Okay. So so happiness, contentment, you're happy with what you are is the biggest your sign of a good health. So what it really does, it called activation of parasympathetic tone. So when we look at a baby, a healthy baby, motor sign, strong digestion, easy elimination, good night's sleep. So when your digestion is good, and we have in yogic sign of proper digestion. Proper digestion means first, lightness in the body and mind. The moment you have a heaviness in your body and mind, especially after a meal, we call it a food coma, that food is not properly digested in your body. Lightness in your body and mind. Second, no smell in the excreta. Very, very important. Our excreta, like stool, urine, perspiration, these are our excreta. If the excreta smells, the food is not part of our body, it's not been properly digested. And then proper, appropriate, we call it a natural urges. There are 13 natural urges, and your appropriate thirst and hunger. We can talk about it, we'll do another session and talk about it. But we look at the signs for proper digestion. And when you don't have proper digestion, in our daily practice, we incorporate 5 asanas, which I'll go show it to you. We call it a Shankha Prakshalan. Shankha means is a metaphor of intestine, Prakshalan means cleansing. We call it a Laghu Shankha Prakshalan. Proper elimination, the sign of health we talk about, a straight spine. If you see a 90, 100 years young person, you will always see the spine is straight. Hunchback never lives long. Straight spine, empty and clean colon. When you don't have any residual stool in the colon, you are healthy. Carrying this feces in your colon is a very unhealthy situation. So you do a asana called a malasana in the morning, sitting down, squatting pose and drinking the glass of water, and you get a bowel movement first thing in the morning. And bowel movement should be, appropriate. The stool should look like a moderate, not too hard. Hard stool comes from the Vata people. A bulky stool comes from the Kapha people, and a moderate stool of this consistency is a normal sign of health. Proper sleep, we'll talk about sleep a little bit and show it to you. Sleep is basically not your quantity of sleep, it's a quality. We have a REM sleep called rapid eye movement and non-REM sleep. Out of non-REM sleep, REM sleep is still your mind is active, and your non-REM sleep, you get 4 stages: stage 1, stage 2, stage 3, stage 4. You need to be in a stage 3 and 4 to have a proper sleep. So if you have a tracker, sleep tracker or a health tracker, you will be able to see that you're in deep sleep. So first and foremost thing, we say that your body is under control of your mind. You take care of your mind, your body will be taken over. Mind is the software, body is the hardware. But you still, as a physician, we start with our physical body. We need to work with our physical body. So what are the things we are looking for? When you look at our daily practice, you can look it off. Like last year, we started on the first few weeks how to start a daily asana practice, daily pranayama practice, daily meditation practice. The first will be your asana practice. First asana, to be healthy, should be able to sit down with your spine straight, able to keep your spine straight, able to walk with your spine straight. Always keep your spine straight. Merudanda Achal, the moment you keep your spine straight, sit down in a chair. This is my chair. You have all seen this one. This is called your kneeling stool. When you sit down, this is a kneeling stool. When you sit down on a kneeling stool, you always keep your back straight. You sit down on a kneeling stool, cannot keep your back hunchback. Here you are at the computer, and I have a motorized table, so you keep your desktop here. Here is your screen, my spine straight. Next one is called Manasthir. Manasthir means mind. You're quieting down your mind. It is called mind in yogic section. It's called 5 senses. I hear, I see, I smell, I taste and touch. So basically what I do a pranayama to quiet down my mind. What is a pranayama? It's one of the practices you have seen. It is called a Brahmari pranayama, bumblebee. Shut down your 5 senses, then you create a vibration. So our brain and body has a state of vibration. 2 vibration cancels and it causes a harmonic resonance. If the vibrations are cancelled, mind quiets down. So do first thing, and also we call it alternate nostril breathing. In alternate nostril breathing, it activates both sides of our brain, brings the balance back, and health in yoga is defined as the balance of your body, mind and spirit. We have all done the Brahmari Pranayam, bumblebee, but let me show it to you a couple of times. You put your index finger in the forehead. You can do Shanmukhi Mudra, or you put your fingers to close your eyes. Then you close your mouth. What you do, you breathe out through your nostril first, then breathe in through your nostril and breathe out with the sound of a bumblebee. frowning and cupping. This is called a activation of the vagal tone. You increase the vagal tone, and the vagus is the nerve which activates a parasympathetic tone. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over your cup. Let the eyes take all the heat from your hand. The eyes get relaxed. The ciliary muscles get relaxed. When the ciliary muscle get relaxed, your lens became more convex. Eye is also supplied by almost 4 cranial nerves coming from your brain. Optic nerve, which supplies your retina, SO4, LR6, superior oblique muscle supplied by 4th cranial nerve, LR6, lateral rectus supplied by the 6th cranial nerve. Then comes your trigeminal nerve, facial nerve. You take your hand and then still massage your muscles. All the muscles in the face and the forehead are attached to your skin. When the muscles are relaxed, all of your frowning goes away, all the line goes away. Your face looks like you are glowing, rejuvenated. Take your hands, massage your earlobe, behind the ear, in front, inside the external auditory canal. It is the auricular branch of the vagus nerve. So it's a vagal stimulation. Take the hand, massage the side of the neck, which is the carotid sinuses. Massaging carotid sinuses activates the glossopharyngeal nerve, and in turn is your brainstem and the vagal stimulation, and it quiets down your cardiovascular system and nervous system. In supraventricular tachycardia, we do massage of the carotid sinuses. Take the hand to the back, massage to your occipital tubercle. There's a muscle, sternomastoid muscle and trapezius muscle, which are supplied by the cranial nerve. So these are the practices you have for maintaining health. What it is, your mind, quieting down your mind. From the pranayama standpoint, the most important pranayama for your body is Kapalbhati pranayama. Kapalbhati pranayama is the breath of fire. Why? Remember the definition of yoga? Sama dhatu, sama agni, sama dosa, sama agni. Agni means your digestive fire, and your Kapalbhati pranayama is called your Agni Pradhan pranayama. Means it ignites your Agni. So, like personally, we always do Kapalbhati pranayama first thing in the morning, and you keep on doing it. I don't know for how long we do it. I know people who said, I've done a 15 minutes, 20 minutes, and a lady told me, she's extremely healthy lady, I do almost 45 minutes Kapalbhati pranayama daily. So if there is a balloon here, there's a balloon here, there is a diaphragm in the middle, push this balloon, air comes out. So we do it all the mudras with the hands, and one of the pranayama session will show everything to you, but today we'll give you the guidance and what are the components of maintaining your health. And you will know, a lot of people say, I cannot do it. So put your one hand in the stomach, put one hand under your nose, and you push your belly button to the back, air will come out. Person says, I still cannot do it. I said, can you cough? Give me a cough. He said, I said, I cough with your mouth closed. It becomes Kapalbhati pranayama. So, Bhramri pranayam, Anulom Vilom pranayam, alternate nostril breathing, Kapalbhati pranayam, these are probably one of the most important. Bastrika pranayam is also very, very important, Because Bhastrika Pranayam improves your lung function. And you look at somebody who is dying, what happens? They expire. The last breath comes out, the lung stops. The lung stops and the heart stops. So the heart stops and the brain stops. Brain stops, all cellular function stops. And we die. So if you improve your lung function, you improve your heart function. Remember, heart and lung is the same organ in yoga. They put a stress in the lung, it will show up in the heart. You put a stress in the heart, it will show up in the lung. Heart function will get better, the brain function will get better, cellular function will get better. We have different ways of doing the Bhastrika, but the best way to do it, raise your hand high up, by active inhalation, active exhalation. And put your hand inside, this is called Adhimudra. We'll do, just give a demonstration, I'll do 10 slow speed, 10 medium speed, 10 very rapid speed. And when you come, we'll do another pranayama session, we'll show it to you, or you can look at my last year's how to start a pranayama practice, it's all there. 10 slow. Medium speed. Rapid speed. We generally do 20 rapid, 20 medium, 20 slow. One cycle, then you repeat the cycle. 2 cycles, 3 cycles, 4 cycles. So improving lung function improves your health. So strong digestion, easy elimination, good night sleep, able to stand keep your spine straight. Even if you sit in a chair, when you sit in a chair, sit down in a chair, go back all the way to the back. Always keep your spine straight. Like sit in a chair, sit in front of the chair, spine will be straight, body will be 90 degrees. If you go to the back of the chair is better, keep your spine straight. If your feet doesn't touch the ground, put a couple of a folded blanket. Then you can keep on removing the foldings and feet gradually will touch. Spine straight. Very, very, very important. Then it will come you'll be able to sit down and call a sit rise test. Very, very important. So you will be able to sit down slowly in a malasana. This is called your squatting pose. So we get up in the morning, first thing in the morning, then first thing we do, sit down in this malasana. So if you look at it here, the whole body is relaxed. My ankle is relaxed, my knee is relaxed, my hip is all the relaxation which lets me get into this asana. Initially, if you cannot get in, you can start like so. You can do it in stages. Like if you come and sit down. So phenomena is called neuroplasticity. If you can stay here for some time, your body knows you'll be able to do it, you'll be able to do it a little bit more. Stay here. In stages, impossible become possible. You can put your hands together, elbow inside, keep your spine straight, eyes closed. You breathe out longer than breathing in. Lung is like a balloon. It has 6-liter capacity. It only needs 1.5 liter to keep it open. 4.5 liter can be exchanged, which is called vital capacity. We only breathe in and out only half a liter with each breath, which is called tidal volume. In all yogic tradition, you breathe out first, breathe in. We practice with a health tracker, so we know what is our health parameter. From there, you will be able to get up without a support. A sit, rise test. And when you get up, you will be able to stand up. Is like a called dandasana, like your like back of your heel is touching the wall, back of my shoulder, my head, then able to take your hands high up and able to stay in a straight dandasana. So from there again, you'll be able to sit down, and when the time comes, when you get a little better and better on this, you'll be able to sit down all the way to the ground. And this is your final test. You're able to sit down in the ground and then able to get up without a support. Sit down to the ground and get up, and there is a phenomenal studies being done. This is better than any other cardiovascular test you will need in your life. If you put a One Health to get up, lose 25% of your health. If you put two hands, I said you lose 50%. Put two hands on the feet, you lose 75%. Next sign of health, very, very important, is that balancing poses, because health is a balance of your body, mind and spirit. So always teach your balancing poses. And most important balancing pose is able to put your feet together. Say, I'm comfortable standing like this. I separate my feet with comfort. See if you can put your feet together and stand. Initially, put your feet little bit of uncomfortable, and then you'll see that you can stand in a non-dominant foot. What is a non-dominant foot? I'm right-handed, right-footed. See if I can stand on my left foot. And when you can stand on the left foot, you keep on counting. If you can count, I'm sorry. So if you have, the balancing becomes an issue, especially for our senior people, you have something to put your hand on. 10 seconds, 20 seconds, 30 seconds, 40 seconds. Then you do, see, if you're able to do it with the eyes closed, when you can stand with your eyes closed for some time, this is a sign of health. I practice every day, still it is very difficult for me. Do the opposite leg now. Then when the time comes, if you can keep your eyes closed and stand. Actually, we practice all of our yoga session with our eyes closed so we can look at our subtle body. Very, very important. When you incorporate a little bit more, as I said, your Kapalbhati Pranayama, the breath of fire, Kapalbhati Pranayama, even if it ignites your Agni, it is a very relaxing pranayama. So we really don't recommend you to do a pranayama practice standing up because it causes altered sense of consciousness. So what we like to do, I want to show you one. The first, a very profound sign of relaxation. What happened here? Okay, somebody probably calling me. Anyway, so I want to show you a profound relaxation. One relaxation is your prayer pose to the back. Put your hands to the back and slowly you can get into the prayer pose. And again, remember, you do it in stages and we have shown you how to do it. So stay in a prayer pose to the back and look at how we combine all the asanas and pranayamas for your health benefits. Then you do your tree pose or a vrikasana. Do it. It's a little slippery in the top, okay? In the tree pose, and here you can do a little Kapalbhati Pranayama. So, prayer pose to the back, Paschim Namaskar, tree pose, Vrikasana. We can do a tree pose. It's slippery here. Okay? You can do a tree pose and then you can do a Kapalbhati Pranayama. So, coming back again, strong digestion. I'll show you 5 asanas, laying down in the mat. Proper elimination, the 5 asanas, I will show it to you. And proper dreamless sleep. Even if you think you need to sleep 6 hours, 25%. 1.5 hours is a REM sleep, rapid eye movement. Non-REM is 4.5 hours, of which 50%, so just little over 2 hours you need a deep sleep. I'll show it to you how to sleep. Then comes your pranayamas, which I've shown it to you. Your Brahmari Pranayam, bumblebee breathing, alternate nostril breathing, Kapalbhati Pranayam, Bhastrika Pranayam, and one of the most important of your pranayama practice is the breath holding both in inhalation and exhalation. But most important is in the exhalation. And these are in yogic tradition are called your Mrito Sanjivani. Mrita Sanjivani basically means, Mrita means dead, Sanjivani means alive. A dead person becomes alive. So the way to do it, and there is a lot of explanation. These are primarily a vagal activation. That means it stimulates your vagus nerve, which, as you know, 80% is afferent. That means going to the brainstem, and 20% is efferent. And the vagal activation is the crux of your yoga practice. There is a lot of called a polyvagal theory now. It is very popular now, but we always knew that yoga practice is a relaxation response, activation of parasympathetic tone, and activation of the vagal tone. So breath holding in inhalation, you will do the breath holding in inhalation, and you are back again. Okay. So what they're going to show? You're going to show something? No. No again? Okay. Okay. Bye-bye. So breath holding in inhalation will be like, call your kumbhaka. Abhantarin kumbhak. Breathing in is purak, breath holding is kumbhak, breathing out is recha. Inhalation, retention, exhalation, and breath holding and exhalation is called suspension. When the lung starts to expand, it expands, and then it does not expand anymore because we have these rib cages. So there is called a herring brewer reflex. In a herring brewer reflex, then start contracting your lung back, which is basically from the activation of the vagus nerve. It also includes a called a chin lock, called your Jalandhar Bandha, and the pranayama is called a Murcha pranayama. Murcha means almost unconscious. Technique is, first you put your hands in a Dhyana mudra, or called meditation mudra. Touch your index finger and thumb, put it over your knees. Breathe out first. Take a deep breath in. Hold your breath. Slowly drop your chin down. Bring your chin close to your chest. Hold your breath and keep counting how long you can hold your breath. You keep on practicing as if it's your normal breath. Remember, the whole yoga therapy practice is called a effortless ease. You do it completely effortless. No pain during asana practice, and complete ease in breathing, no effort in breathing, and then you will see slowly and slowly you can build it up. 40-45 seconds, breath holding and inhalation, is an extremely good practice. It's a sign of health. These are called Mrito Sanjivani. That person became alive. Breath holding in exhalation is called an Uddiyani Bandh or abdominal lock. And the practice is done, you breathe out first, take a deep breath in, completely breathe out, suck your stomach in and hold. I generally also use the Adhi Mudra because Adhi Mudra is very relaxing. These are called Bala Mushti Mudra. Breathe out first. Deep breath in. Completely breathe out. It's about 20 seconds. You can hold breath holding in exhalation. Breath holding in exhalation is another sign of health. So breathe out first, take a deep breath in, completely breathe out, suck your stomach in and hold. For your digestion, we call it umbilical centering. Umbilical centering is not being as popular in Western practice. Our belly button is not centered. So what you do, you lay down, put your finger at the level of your belly button. Finger in your belly button, push it down, push it down. You will feel a pulsation called an aortic pulsation. If you don't feel the pulsation, belly button is not in the center. Take a thread from belly button to measure the tip of your toe. Both sides should be equal. For a male, you can do from here to the nipple line, both should be equal. Female, you can do from belly button to the collarbone, medial end of the collarbone or clavicle, both should be equal. If they're not, in your asana, few asanas. First one is called Utthita Padasana, feet raising. Just raise your feet, not all the way high up, 30 to 45 seconds. From there you go to call your Naukasana, boat pose. In a boat pose you'll see initially you'll have a lot of shaking, but slowly it will come down. From the boat pose you go to called knee chest, Pavan Mukta Asana. I'm showing you these asanas, but during your practice, you should stay in the asana at least every asana 5 to 10 breath. I'm showing you because of the time constraint, but you can look at this and you can do it later. Bridge pose, Setu Bandha, Sarvanga Asana, touch the back of your feet, keep it separated at a shoulder distance, slowly raise your body high up, like a bridge pose. Once your body is way, way high up, just to balance, if you can do it in a one-footed bridge, and come down slowly. Feet touching your forehead, take your toes, it will touch your forehead. These are igniting your Agni. Also, from here, you can do a shoulder stand and a plow. Shoulder stand and a plow will be excellent for your relaxation and improving with your shoulder stand all the way high up. Slowly go down. Able to sit down in Vajrasana. Vajrasana or a thunderbolt is the asana for your digestion. Every asana we practice is done in our empty stomach in the morning. The Vajrasana is the one which is, we do it in our full stomach, especially after a meal. When we eat a big meal, we'll sit down and we sit down. Yeah? Very simple Vajrasana, keeps your spine straight and up. It's a wonderful asana and it's primary activation of parasympathetic activation and helps in digestion. These asanas are also called your umbilical centering, Agni, igniting your Agnis. Proper elimination, called Shankha Prakshalan. You start with 3 asanas first, which is standing up asanas. Okay, let me show you the first standing up asanas. The first one, these are called your, actually the way it is done, you drink 2 glasses of water, especially with a little bit of salt in it, and do these 5 asanas. You may not have any bowel movement, then another 2 glasses of water. Again to the 5 asanas. Keep drinking the water. You will see you're starting having bowel movement. Generally it takes 30 minutes to 45 minutes. Initially the stool will come out and essentially all the clear water will start coming out. It is a practice. We do it maybe once every 6 months, but for we call it a without water drinking water, it's called a Laghu Shankha Prakshalan. We do it about almost daily. I do it daily. Put your feet together, Utthita Tadasana, upward mountain pose. Hands sway high up. You can put your hands like this and go high up, and then get into your tippy toes and stay high up. Utthita Tadasana. Then is your Tirjak Tadasana. Tirjak Tadasana means oblique mountain pose. In a Tirjak Tadasana, what you do, you put your hands together. Best way to do, put your hands in the elbows, put it over your head. That's the way you stay completely stable. Breathe out first, take a deep breath in and slowly turn to one side. Again 5 asanas. Upward mountain pose, oblique mountain pose, again people ask for breathing. Breathing should be completely effortless breathing as if it's a normal breath. Breathing out longer than breathing in and able to stay in the pose between 5 to 10 breaths. Do with your eyes closed. Very, very important concept in yoga practice. In a group practice, you will always look into your body, which is subtle body, and you don't know who else is doing. This is going to be a non-competitive practice. Kati Chakrasana, West rotation pose, the feet separated, hands in front. Breathe out first. Take a deep breath in, slowly turn your body. West rotation pose. Kati Chakrasana. You get almost all the way to the back. Come back again on the side. Breathe out first. Take a deep breath in. Same breath. Breathe in, come back in the same breath out. And also do with putting your hand in the shoulder. Left hand in the right shoulder, right hand to the back. Breathe in, breathe out. Slowly turn your body. On the left hand, you'll turn on the left side. Right hand, opposite side. Left hand goes here. Breathe out first. In. Kati Chakra Asana. Next will be your Tirjak Bhujangasana, oblique cobra pose. Get into a cobra pose. In cobra pose, you keep feet separated, feet together, separate your feet. Slowly get up into cobra pose. Bhujangasana, Bhujangasana, cobra pose. Over the left shoulder, look over your slowly get up again. Over right shoulder, look into your left foot. Slowly come down. Tirjak Bhujangasana. And finally is your Udar Karshanasana. Able to sit down in squatting pose, Malasana, then able to do your stomach churning, Udar Karshan Asana. Sit down in a Malasana, the right knee in front of your left knee. Put your left knee, slowly turn your body to the back. Left knee comes front of the right foot. Right knee comes here. Five asanas for proper elimination. Remember, one sign of health is empty and clean colon. If you don't have the bowel movement first thing in the morning, carrying that stool in your colon rest of the day is not a healthy situation. Sleep is extremely important, and sleep is not your quantity, it's the quality of sleep. Most of the yogis who sleep only a few hours. They generally go to bed by 10, then wake up 3 o'clock or 4 o'clock in the morning, because waking up between 4 to 6, that is called a Brahma Muhurta, time of the Brahmas. The person who sleeps well, the babies. We call it sleep like a baby, another called sleep like a yogi, another called sleep like a log. Log. Baby, if you say baby, baby will always sleep with your feet together and like this. Supta Baddha Konasana. Closed angle pose, laying down. If you have an issue putting this, you can put a little bit of a pillow under your knees, but you'll be able to stay. Hands, palm facing high up. Next you will see in a baby, what the baby do? Baby will do abdominal breathing. In abdominal breathing, when you inhale, abdominal wall will go high up, and exhale, it will come down. Inhale and exhale. Abdominal breathing is coming and cooling. Chest breathing, thoracic breathing is to improve strength and stamina and improving pulmonary function. Let me show you the steps which yogic sleeps. Yogi will start sleeping like this, flat in the bed with a Supta Baddha Konasana. Then they will first incorporate 5 to 10 breaths, abdominal breathing. Then we'll do breathing out longer than breathing in. Third breath they will incorporate, it's called breath holding. And I'll show you how to do the breath holding. Generally we'll do 5 to 10 counts, but I'll show you 1 or 2 counts just to see how to do it. After abdominal breathing, we'll do. See, it's very easy to do count of 3 in, count of 6 out. For us, we'll be doing for a long time. Let me show you count of 10 out and count of 5 in. It'll be 5 seconds in, 10 seconds out. First, we always breathe out, 10 seconds out. Five seconds in. Again, 10 seconds, 10 count out. Five seconds in. You can keep increasing exhalation longer, preferably twice the inhalation. Sometimes you do 1.5 or 2. Within a short time, you'll see you are falling asleep. Incorporate breath holding. Breathe in with a count of 4 in. Breathe out first. Breathe in with a count of 4 in. Breath holding for count of 16. Exhalation for a count of 8. basically the ratio 1 is to 4 is to 2. Again, inhalation, let me increase one more time because we've been doing it for a long time. Inhalation for a count of 5 in. Hold for 20. Breathe out to the count of 10. After this practice, initially, yogi will sleep in a fetal position on the right side. It is all about a balance. Initially, our body core temperature is high up. Left nostril breathing is cooling. When you sleep on the right side, left nostril opens up. It balances the warm heat in your body. They really don't have any pillows. They use their hands to put your head. But if you want to use a pillow, you can use a very small pillow here. On the right side, fetal position for initial part of your sleep, because you need to bring the balance. Once the initial part is over, the majority part of sleep is done on your left side, because now the body core temperature is coming down. Right nostril now opens up and right nostril is heating, and it's going to balance the cooling inner core temperature. Also, the inferior vena cava, the main channel which brings the blood in our heart, is completely free of any pressure, because it's a low pressure system. With the pressure of the abdominal contents, it reduces its venous return. Since the venous return is good, the preload, the blood coming to your heart is getting more and more, and with relaxation, the afterload goes down, the heart function gets better. I personally sleep this way throughout the whole night. Try this, you will have a wonderful sleep, and when you wake up, you feel very refreshed, and you will know that you have a good night's sleep when you are not sleepy in the daytime. When you get up, straighten up your right leg first, put a little support in your hand. When you get up, sit down, and don't get up from the bed right away. We call it a 90 seconds rule. Sit down for 30 seconds to stabilize your hemodynamics, because your hemodynamics is unbalanced when you are sleeping. Stand up again, 30 seconds. Slowly walk for 30 seconds, then you start become your active. So follow the 90 seconds rule. You should not have any issue or any problem. Once you get up, suddenly you develop called a postural hypotension, and you may even pass out, give a blackout spell, and a lot of things happens, especially for senior people. If you get a fall, that is the downhill course of your life. Able to get up, without the support from here is a very, very important practice. So these are all the practices to improve your health, and this is your, what should I say, your New Year's resolution to do all this stuff. How to measure the right health? The first, you're called BMI, body mass index. Body mass index is measured weight in kilogram divided by height in meter square, and normal is your 18 to 25. Below 18 is called malnutrition. 18 to 25 is normal. 25 and 30 is your obesity started coming in. Above 30 is obese, and above 35 is called, you call it morbid obesity. Another way is very important sign of health is your truncal obesity. The truncal obesity, the gross obesity is not the problem with the health, because the stress, the end product of your stress is your cortisol. Cortisol converts your sugar, residual sugar, into your fat called omental fat. Omental fat is inside your abdomen. So omental fat acts like an endocrine organ. It secretes your pro-inflammatory molecule, adiponectin, and that chronic inflammation is a root cause of all of your lifestyle disorders. So the waist size is all being described as a, like a Western term, 40 waist for men, 40, 30 for it. It doesn't make any sense, What it makes sense is that your height in inch and waist should be half of your height in inch. Like I'm 5 feet 8, so what is 68? My waist should be less than 34. My waist is about 30, 31. I'm probably in a good, your body sign of health. Height in inch and waist should be divided by half. Waist hip ratio. See, a lot of people have a wider hip, but that is not a health hazard. Health hazard is here. So for a man, the waist hip ratio is about 0.9. For women, generally is about 0.85. Yogi has another way of saying. Yogi says, okay, look at your body. Put your hand around your wrist. So if you look at your wrist, you'll have some overlap. So here I am. So here you see the overlap. That means my thumb. So this much is the overlap. Maybe inch or inch and a half. Take the same hand, you take at the middle of your arm, the amount of overlap should be the same distance in between. That's what it exactly looks like. Whatever overlap I have, and that is the distance I have here in between my, you can see it in between my fingers. Then you go back to your thigh, from the greater trochanter, the bone you feel from the knee, halfway, you can put your hand around, you will be able to put both the hands around middle of your thigh. Yogic BMI. Finally, another yogic BMI, put your hand on the side and bring your hands together, and at the level of your belly button, you will be able to touch both of your middle finger. So hands on the side, bring it close, and able to, let's see, underneath your clothing, able to touch your Okay, I think this was a lot of for the beginning of the year. Uh, Time is approaching. I hope you get some ideas how to continue, and if you improve your health, we call it money back guarantee. No disease will come to you. You will be protected like your what is called your antiviral software. Any comments, any questions, please let me know. If I'm in town, I will definitely do the session again. Next Saturday, I'm not sure, I may have another program, but if I am, I'll let you know beforehand. And please, again, put some questions and comments for me. Okay, see you probably next Saturday. Bye bye.